Have you ever looked at your legs in the evening and noticed they seemed a little puffier than usual? Or maybe you've been waking up 2, 3 times a night to use the bathroom and you just thought, well, that's just age. That's just how things are now. But what if it wasn't? What if your body has been sending you quiet, careful signals? Signals that most people completely miss, not because they aren't paying attention, but because nobody ever told them what to look for. Today, we're going to change that because the truth is your kidneys, two small bean-shaped organs sitting quietly in your back, are responsible for far more than most people realize. They filter your blood, they control your fluid balance, they regulate your blood pressure, they even affect how you sleep, how your skin looks, and how much energy you have when you wake up in the morning. And when something starts to go wrong with them, they don't send you a sharp pain right away. They don't announce themselves loudly. Instead, they whisper through your face, through your feet, through the color of your urine, through the way your hands feel when you wake up. Many people walk around for months, sometimes years, with early kidney problems and never connect the dots. They treat the tiredness with more coffee. They put compression socks on swollen ankles. They blame poor sleep on stress or age. And all the while, the real cause goes unaddressed. Today, I'm going to walk you through 17 signs that your kidneys may be struggling. Signs you can actually see and feel on your own body, right now, at home. No lab tests needed to start paying attention. Some of these will surprise you. A few of them may already be familiar, and that's exactly why you need to stay with me until the end. Because knowing what to look for is the first step toward doing something about it, and that could make all the difference. Let's start with something you've probably never connected to your kidneys before: your face. Specifically, your eyes. Not your vision, not your glasses prescription, but the area just beneath your eyes, right along the upper cheek. That soft, slightly puffy area that some people wake up with in the morning. Most people think it's tiredness, or maybe they slept on the wrong pillow, or perhaps they had a little too much salt with dinner. But here's what many people don't know. When the kidneys begin to lose their filtering ability, protein starts leaking out of the body through the urine, protein that is supposed to stay inside your bloodstream, and when that protein level drops, fluid begins to shift. It moves into the soft tissues of the body, and one of the very first places it appears is right beneath the eyes. It's called periorbital puffiness. But forget the medical term. Just remember this. If you're waking up regularly with swollen, baggy under eyes, and it's not going away after a glass of water and a walk around the flat, your kidneys may be asking for attention. Now let's move lower, to the ankles. This is one of the most common signs, and one of the most overlooked. You sit in your chair all evening, you watch the television, you have your cup of tea, and then when you stand up and look down, your ankles are thick, rounded. Maybe your socks have left deep marks in your skin. People assume it's the heart. Sometimes it is, but the kidneys are just as responsible for this kind of swelling, because when they can't properly regulate sodium and fluid in the body, that fluid pools. It sinks to the lowest point, your feet, your ankles, sometimes your calves. And here is something important. If you press your finger firmly into the swollen area and hold it for a few seconds, then release and the indentation stays. If the skin doesn't spring back immediately, that is a sign worth taking seriously. Doctors call it pitting edema. You can check for it yourself right now at home. But swelling is only the beginning. Let's talk about something that happens every single day, multiple times a day, and yet most people never examine it closely enough. Your urine. I know it's not a comfortable topic, but this is genuinely one of the most powerful windows into your kidney health, and ignoring it means missing information your body is freely giving you. Healthy urine should be pale yellow, light, clearish, like lemonade that's been watered down. But when the kidneys are struggling, several changes can appear. The urine may become foamy, not just a few small bubbles that disappear in seconds, but a persistent, frothy foam that lingers in the toilet bowl even after flushing begins. This foam is often a sign of protein in the urine, the same protein that should be staying inside your blood. The urine may become darker than usual, a deep amber, or even a brownish color, which can signal that the kidneys are not properly clearing waste from the body, or the opposite may happen. You may find yourself urinating far more often than usual, especially at night. You go to bed, you fall asleep, and then at midnight, you're up. At 2 in the morning, you're up again. You're exhausted by morning, and you don't know why your sleep has become so broken. Many people blame their bladder, or their prostate, or simply aging. But disrupted nighttime urination, what doctors call nocturia, is a classic early signal that the kidneys are not concentrating urine correctly during the night. Healthy kidneys reduce urine production while you sleep so your body can rest. When that mechanism begins to fail, the night becomes restless. Now, here's something that often gets missed entirely because it doesn't look dramatic. It feels subtle, easy to brush aside. Fatigue, not ordinary tiredness after a long day, not the kind of tiredness a good night's sleep fixes. This is a heavier fatigue, a fatigue that sits in your bones. You wake up tired, you rest, and still feel tired. Simple tasks feel heavier than they used to. Climbing the stairs leaves you more breathless than it should. You feel a kind of fog, not quite sharp, not quite yourself. This happens because the kidneys produce a hormone called erythropoietin, a signal that tells your bone marrow to produce red blood cells. When kidney function drops, this hormone drops too. Fewer red blood cells means less oxygen reaching your muscles, your brain, your heart. The result is a fatigue that no amount of rest seems to fix. It's not laziness, it's not depression, it's your body running low on the oxygen it needs because the signal from the kidneys has gone quiet. And here is something that ties all of this together, something that makes these signs even more urgent to understand. Kidney disease in its early and middle stages is almost completely silent in terms of pain. Your kidneys have no pain receptors inside them. They cannot hurt you the way a sore muscle does or an inflamed joint does. They suffer quietly. They compensate quietly. They decline quietly. By the time most people feel significant discomfort, real, undeniable symptoms, the kidneys have often already lost a significant portion of their function. That is why these visible physical signs on your body matter so much. They are your early warning system. They are the messages your body sends when it can no longer stay completely silent. And we have only just begun, because there are more signs, ones that appear on your skin, in your breath, in your hands, and even in the way your legs feel at night, that most people would never think to connect to their kidneys. Let's talk about your skin, because your skin tells stories that most people never learn to read. When the kidneys are healthy, they work around the clock filtering waste products out of your blood, quietly, efficiently, without you ever noticing. But when that filtering system begins to slow down, those waste products don't disappear. They have nowhere to go. So they build up, they circulate, and eventually they reach the skin. One of the first things people notice is itching, not the kind of itch from a mosquito bite or dry winter air. This is different. It's deeper, it moves around, it's there on your back, then your arms, then your legs. You scratch one place and another one starts. It wakes you up at night. It doesn't respond well to moisturizer or antihistamines. This is called uremic pruritus, and it happens because waste compounds, particularly something called urea, begin accumulating in the blood and eventually depositing into the skin tissue itself. The nerves in the skin react, they fire, they tell your brain, something is wrong here, scratch here, fix this. But no amount of scratching fixes it because the problem isn't on the surface, it's in the blood. And alongside that itching, the skin itself can change in appearance. It may become unusually dry, not just normal seasonal dryness, but a persistent, almost leathery dryness that doesn't respond to cream. It may take on a dull grayish or yellowish tone, particularly noticeable on the face, the neck, and the backs of the hands. In some people, a pale brownish discoloration develops gradually, so slowly that the person doesn't notice. But family members sometimes remark that they look different somehow, tired in a different way. These color changes happen because the kidneys also help regulate certain pigments in the body, and when waste builds up in the bloodstream, it affects the way the skin reflects light. The glow disappears. The skin looks heavy and tired even when it's been washed and cared for. Now let's go to something that many older adults experience, but almost nobody connects to the kidneys: a strange taste in the mouth, or a smell on the breath. People often describe it as metallic, like old coins on the tongue, or sometimes And this one surprises people, an ammonia-like smell, like cleaning fluid, faintly on the breath. Some people notice it themselves. Others first hear it from someone close to them. This happens because when urea, a waste product that healthy kidneys remove, builds up in the blood, the body tries to release it through other pathways. One of those pathways is the breath. Bacteria in the mouth break urea down into ammonia, and that ammonia rises to the surface. It has nothing to do with dental hygiene. Brushing and mouthwash won't touch it. Because again, the source is not the mouth. The source is the blood. And connected to this, many people find that their appetite begins to change. Foods they used to love suddenly seem unappealing. They sit down for a meal and feel full after just a few bites. Sometimes there's a low-level nausea that hangs around without a clear cause. Not severe enough to be alarming, just enough to make eating feel like a chore. This loss of appetite, this nausea, this disinterest in food, it's the body's response to elevated waste products in the blood. The digestive system slows. The stomach signals discomfort. The brain begins to associate eating with that unpleasant feeling, and naturally, appetite drops. This is one reason why some people with declining kidney function begin to lose weight without trying. They simply stop eating as much. And because the weight loss is gradual and they're not in dramatic pain, they often assume they're just eating less as they get older. But it's worth paying attention to. Now, let's move to the legs, and specifically to something that happens at night in bed when everything should be quiet and restful. You lie down, you close your eyes, and then it starts. A crawling sensation in your legs, or an irresistible urge to move them. A restlessness that is almost impossible to describe to someone who hasn't felt it. It's not pain exactly. It's not a cramp exactly. It's somewhere in between. An internal discomfort that only eases when you move your legs, when you walk, when you shake them out. This is called restless leg syndrome. And while it has multiple causes, kidney disease is one of the most commonly overlooked ones. When the kidneys struggle, the balance of certain minerals in the blood shifts. Iron levels can drop. Dopamine pathways in the nervous system are affected. And the result, in many people, is this maddening nighttime restlessness in the legs that makes sleep nearly impossible. People try stretching. They try magnesium supplements. They try sleeping in different positions. And nothing really works. Because again, the root cause is deeper than a tight muscle or a mineral deficiency alone. And while we're talking about the legs, let's mention muscle cramps. Sudden sharp cramps in the calves, in the feet, in the thighs. Cramps that wake you from sleep with their intensity. Cramps that seem to come from nowhere. When kidney function declines, the balance of electrolytes in the blood, sodium, potassium, calcium, phosphorus, becomes disrupted. These minerals are essential for muscle contraction and relaxation. When they fall out of balance, muscles misfire. They contract without warning. They hold that contraction far longer than they should. This is important. This is very important because so many older adults simply accept these nighttime cramps as a normal part of aging. They have been happening for years. They've bought special pillows, special blankets, special socks. But the kidneys may be at the center of it all. Let's go even further because there's one more sign in this group that is surprisingly easy to overlook. Changes in how often you urinate. Not just at night, but throughout the day. Some people find they are urinating far less than usual. Their output has dropped noticeably. Maybe they used to go 5 or 6 times a day, and now it's 2 or 3 times, even though they're drinking the same amount of water. This reduction in urine output is a serious signal. It often means the kidneys are filtering significantly less blood than they should. The body is retaining fluid it should be releasing, and all of that retained fluid goes somewhere. Back into the tissues, back into the bloodstream, raising pressure, causing swelling, straining the heart. Others find the opposite. They urinate frequently, urgently, but in small amounts. A constant feeling of needing to go, combined with a disappointing result when they do. This too can reflect kidney and urinary tract stress. Neither pattern should be dismissed. Neither pattern is simply aging. Your body is precise. It is not random. When patterns change, when something that has been consistent for decades suddenly shifts, that change is always communicating something. And here is the quiet truth that ties everything in this section together None of these signs are dramatic on their own. None of them will stop you in your tracks. None of them will send you rushing to the emergency room. That is exactly what makes them dangerous. Because they accumulate, they pile quietly on top of one another, the itching that started 6 months ago, the metallic taste you've had for a while, the swollen ankles in the evening, the restless legs at night, the fatigue that never fully lifts. Individually, easy to explain away. Together, they form a picture. A picture that your body has been painting for you, carefully, patiently, hoping you would eventually stop and look. And now comes the part that matters most. Because understanding the signs is powerful, but knowing what to do next, knowing how to respond, what to change, what to watch, what to bring to your doctor, that is where real protection begins. Let's talk about something most people never consider: your breath. Not the smell of it. We touched on that already, but the pattern of it, the rhythm, the depth. Have you noticed that sometimes, without any physical effort, you feel slightly short of breath? You're sitting in your chair, you're lying in bed, you haven't climbed any stairs, you haven't carried anything heavy, and yet there's this quiet sense that you can't quite fill your lungs completely. Like there's something sitting on your chest, light, but persistent. Most people blame the heart, or the lungs, or anxiety, but the kidneys are deeply connected to your breathing rhythm in ways that genuinely surprise people when they first hear it. When kidney function drops, fluid can begin to accumulate not just in the ankles and the face, but around the lungs themselves. A thin layer of excess fluid pressing gently against the lungs from outside. Not enough to feel dramatic, just enough to make every breath feel slightly incomplete. And at the same time, the anemia that comes with kidney decline, that drop in red blood cells we talked about, means less oxygen is being carried through the body with each breath. So the lungs work harder. The breathing becomes slightly more labored, slightly more frequent, and the body quietly, constantly, feels like it is not getting quite enough air. This is not anxiety. This is not imagination. This is physiology. And it matters. Because breathlessness at rest, even mild breathlessness, is one of the signs that the body's internal balance has shifted significantly enough to affect basic functions. Now let's talk about something that lives in the back, literally. Many people with kidney problems describe a dull, persistent ache in the lower back, not in the spine itself, not in the muscles from lifting something heavy, but deeper, slightly to one side or both sides. In the area just below the rib cage toward the back. It doesn't usually feel sharp. It doesn't usually feel like a stabbing pain. It's more like a pressure, a heaviness, a soreness that sits there quietly throughout the day and never quite goes away. People put heat pads on it. They buy back support cushions. They blame old age and old furniture. And sometimes, yes, back pain is just back pain. But kidney-related discomfort in that region is real, and it is frequently mistaken for a musculoskeletal problem. Kidney cysts, kidney infections, kidney stones, all of these can create that specific, deep flank discomfort that many older adults carry around for months before anyone thinks to look at the kidneys. If your lower back pain is persistent, if it doesn't change when you stretch or move, if it sits in that specific zone below the ribs toward the sides, it deserves attention beyond a heat pad. Now, here is something that most health videos never mention, and it is one of the most telling signs of all. Your concentration, your thinking, your mental sharpness. When waste products build up in the blood, a condition doctors call uremia, the brain is affected. Not in a dramatic way at first, not in a way that looks like dementia or a stroke, but in a subtle, creeping way that the person experiencing it often dismisses as tiredness or stress. You find yourself reading the same sentence twice. You walk into a room and forget completely why you came. You lose the thread of a conversation mid-sentence. You feel foggy, not confused exactly, but not quite sharp either, like thinking through cotton wool. This cognitive cloudiness is real. It has a physical cause, and for many people, it is deeply distressing because they fear it means something is happening to their mind. They fear memory loss. They fear decline. But when the kidneys are treated and function improves, in many cases, the mental clarity returns. The fog lifts, the thinking sharpens again. That is not a small thing. That is everything. And now, let's bring this all together, because you've been with me through 17 signs. Some of them were obvious, some of them surprised you, some of them may have felt uncomfortably familiar. And if that is the case, if several of these signs have been sitting quietly in your life, then this moment, right now, is important. Here is what you need to do, and I want you to hear this simply and clearly. First, hydration. The kidneys depend on water to function. Not tea, not coffee, not juice, plain water. Most older adults are chronically mildly dehydrated without realizing it because the thirst sensation weakens with age. If you are not drinking at least 6 to 8 glasses of plain water throughout the day, start now, today, not tomorrow. Second, reduce your salt. Excess sodium forces the kidneys to work harder to maintain fluid balance. It raises blood pressure directly. It worsens swelling. Processed foods, packaged soups, cured meats, salty snacks. These are the biggest sources. You don't need to eliminate everything overnight, but becoming aware, reading labels, choosing lower sodium options, this is something your kidneys will feel immediately. Third, be careful with painkillers. This one is critical. Non-steroidal anti-inflammatory drugs, the common pain tablets that millions of older adults take regularly for joint pain, back pain, headaches, these medications, taken frequently over time, are one of the leading causes of kidney damage in older adults. They restrict blood flow to the kidneys. They cause slow, silent damage that accumulates over years. If you are taking these regularly, speak with your doctor about alternatives. This is not optional. This matters deeply. Fourth, manage your blood pressure and blood sugar. These two conditions are the number 1 and number 2 causes of chronic kidney disease in the world. High blood pressure damages the delicate blood vessels inside the kidneys. Elevated blood sugar, even borderline high sugar, does the same. If you have either of these conditions, controlling them is not just about your heart or your energy. It is directly protecting your kidneys every single day. Fifth, and perhaps most importantly, get a simple blood and urine test. Just 2 tests. A blood test that measures creatinine and estimates kidney filtration rate, and a urine test that checks for protein. These are basic, they are inexpensive, they are available at any clinic, and they can tell you clearly and specifically exactly where your kidneys stand right now. Not guessing, not worrying, knowing. Because knowledge is not frightening. Knowledge is power. Worry is what happens in the absence of information, and you deserve information. Here is the final thing I want to leave with you today, and I want you to really hear this. Your kidneys have been working for you every single minute of your life, every minute you were asleep, every minute you were busy, every minute you weren't thinking about them at all. They filtered your blood. They balanced your fluids. They protected your blood pressure. They kept you alive and functioning quietly, without complaint, without recognition. They deserve the same care and attention in return. And the beautiful truth is this: caught early enough, kidney disease is manageable. Function can be preserved. Decline can be slowed dramatically. Quality of life can be protected. People who find out early and make changes early go on to live full, active, healthy lives with their kidneys still working, still filtering, still doing their quiet, essential job. You watched this entire video today. That means something. That means you care about your health. That means you are paying attention. And paying attention, truly paying attention, is the beginning of everything. Take care of your kidneys. They have never stopped taking care of you.